Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. Thanks for joining us today. And our guests are Joy Bowlin and Nisha Panday with Reid Cardiology and Bethel Cardiology. And welcome, ladies.
Thank
and
you.
as you will see, we're all in red today for Go Red for Women month. And but before we get into that, tell us how you came to Reid, both of you. I'm going to start with Nisha.
Sure. I actually have an acute care background. So basically, I was working inpatient hospital care, acute care nurse practitioner for several years. And I kind of got, tired of that. So I was looking for some specialty. So one option was cardiology. And I had worked with Dr. Chong with Bethel Cardiology for a long time. So this opportunity opened up, and I just jumped in.
It was a natural fit.
And it was recently. I haven't been practicing cardiology for a while. I'm new to the practice.
Joy?
I've actually been at Reid for 15 years. I started out at the old hospital, and I worked in bedside nursing as a cardiac nurse there on the nursing units. And then I transferred to the cardiac cath lab and electrophysiology lab. And I spent about 10 years working in that area. And then once I graduated as a nurse practitioner, it seemed quite right to continue in cardiology. And so I was fortunate to be able to continue working with cardiology, and I work in electrophysiology.
Great, and we are so grateful for your experience and joining the Reid team. We wanted to talk today about what is Go Red for Women, and we know that's celebrated in February. Tell us, and why do we celebrate that?
So basically, Go Red for Women is kind of like a program initiative by American Heart Association to kind of make women aware of heart disease and kind of be proactive and be aware of prevention strategies. So basically, just to improve the lives of women in general globally, that's what the Go Red is.
And one of the reasons for it, I looked at one number saying that heart disease is the #1 killer of women.
Yep.
And often, I know in the movies that you see someone, they clutch their chest, it's pretty dramatic, and I know that we're going to expound upon that's not always the reason, and that's not really what happens in real life. So we wanted to get your thoughts on that, Joy.
Yeah, that's very true, because especially in women, a lot of times heart disease presents in a more atypical manner. So you always think of, as you say, someone, clutching their chest, having chest pain. And while some patients will experience that with a heart attack, a lot of patients have other symptoms that are less specific. Especially in women, you'll see fatigue, nausea, some back pain, just kind of weakness, symptoms like that, shortness of breath. A lot of times it presents more vaguely instead of just that obvious crushing chest pain.
Now, what are some of the statistics with heart disease, especially with women?
Yeah, so as you said, heart disease is the leading cause of death in the United States, and there's approximately 2,200 deaths daily from heart disease. And if you think about that broken down further, that's a death approximately every 39 seconds from heart disease.
And statewide, are there different? I know it's pretty much very similar, I'm sure.
Yeah, I don't have specific statewide numbers.
And then regionally, I'm sure it's all. That's because that's why we're really trying to focus more on the causes for women. So who's at risk, and what are some of the risk factors?
Well, their risk factors generally is like hypertension, hypercholesterol, like high cholesterol, and if you're diabetic, or if you're overweight and you have family history and you kind of have like sedentary lifestyle, those are pretty much like high risk people. And usually it's been shown that some of these risks can be decreased by modifying your lifestyle and your diet, and it can actually change up to like bring down the risk as low as about 80%.
And smoking is also a really big risk factor too.
Forgot that one.
Something we harp about.
Yeah, that's modifiable too.
So when you are counseling or seeing your various patients, and these are some of the things that you try to when they're sharing and seeing what they're doing in their lifestyle. So you would try to counsel them about changing the
Yes.
negative
Yeah,
lifestyle.
that's part of our job. You know,
Absolutely.
basically prevention.
And what would you say, how much is the percentage of the hardest part of your job with the prevention? And just really trying, do you see some people, it takes them a little longer than
yeah.
others to
It's-
start to follow the rules?
Yeah.
Yeah, because I think,
It's
people a
hard.
lot of times have good intentions, but the reality of day-to-day life, a lot of times it's harder to be
It's
compliant.
hard, yeah.
Right.
You know, even if I think about it, when I have something, I have a habit, it's hard for me to break that habit if someone tells me to just break it. It's hard. It's hard.
Right.
Like it's addiction type of.
Yeah. And
So-
even with diet and that sort
Yeah.
of thing, a lot of times that has to do with, your lifestyle and how much time you have to prepare meals and, what's available locally and things like that. So there's a lot of barriers.
And especially, here, America, it's like the food is always available. It's hard to say no. Like,
You just you can just
Yeah.
go through the drive-through and get something. And often, the healthiest options aren't available through the
No.
drive-through,
Yes, true.
or as economically available as well. The symptoms. What are some of the symptoms to be aware of?
Yeah, so like you said, the one is very obvious, chest pain, chest discomfort. Some people describe it as a heaviness, a tightness, a squeezing, symptoms like that. Sometimes they'll have radiation to either one arm or both arms. You can have jaw pain, neck pain, shortness of breath. I feel like that's a very common one. People will just start saying, I just started feeling more short of breath with activity. I just noticed that I was trying to do things and I was kind of getting winded. Sometimes they'll get lightheadedness, dizziness, fatigue, kind of an unusual cold sweat type of a feeling, things like that.
And during this time of the year, people just say, "Oh, I think it's the flu,"
Yes.
and so do you see that as well?
Yeah, I have seen that in the past, and definitely, you always want to caution people. I feel like, it's always okay to take chest pain seriously. Like if you present to an emergency department with chest pain, even if it turns out it wasn't anything cardiac related, we're always, appreciative that someone come in to get that checked out, because the sad thing is, unfortunately, if you continue to have symptoms and you ignore those, someone comes in with a late presentation, a lot of times then it's a completely different scenario trying to manage that and decreases survival.
And with some of the symptoms that you mentioned, and being a woman, you would say with nausea or whatever, that's nothing, or even with the shortness of breath, I'm just been overextending myself. So that's why we with the wear red, and then trying to make women think about it more. So hopefully, as we're educating people, they will understand that it could be possibly something more than just a cold.
Yeah.
And please take it seriously.
Yeah, absolutely. You don't want to ignore the subtle signs.
Yeah. It's cardiogenic until it's ruled out, basically.
Okay. And also, those are because with females being often the caregivers of the family, they often will not seek out help. Do you see that happening?
Absolutely. Yeah, they tend to be the last one to look at their own health a lot of
Right,
times.
so they're not taking care of their own selves. So that's why we want to reiterate that people should take note of the various symptoms that they could have. So what are some of the first steps to address those possible signs when people see those signs?
So if you're having on and off symptoms, like, it's not persistent, it's a good idea to talk to your primary care provider and talk about symptoms and what's going on with, your health. And based on what your symptoms is, your primary care provider may order some tests or refer you to a cardiologist. Now, if you have persistent chest pain, and all of a sudden, and you're like, it seems like it's a heart attack, you need to go to ER. You need to call 911. So that's the first step. And it may not be anything, like Joy said. It may not be anything. It may not be cardiac, but you need to do that right away.
It's always better to be safe
Correct.
than sorry.
Yeah, absolutely.
Did you have anything to expound upon?
Well, I
with
think to that point of, certainly we'd much rather someone come in and it rule out and not be cardiac as to have someone that really was truly having a heart attack and didn't come in. Because for the most part, if you catch a heart attack quite early, most times quite treatable. You know, a lot of times you can actually treat it without having significant lasting damage. But if you wait and, you know, it's later, a couple days later, that sort of thing, very often you can have lasting permanent heart damage that then becomes a whole nother thing to try to manage throughout your life versus just an acute episode.
As we like to say in community education, it's better to check a $100 problem before it becomes a $100,000 problem.
Absolutely.
And often people said, "Oh no, I'll handle that." But do you find people that haven't been to visit their primary care doctor? Do you get a lot of that?
I have, you know, I have seen that, and I've seen like there's a lot of people who don't have a primary care
True.
provider.
Yeah.
So they either go to ER or, you know, outpatient clinics, but they don't really have a person who they can follow up with, and that's a difficult situation too.
So it definitely becomes a $100,000 problem. So, and so once again, trying to make sure that people do have a primary care physician and not waiting until the last minute
that's very
is very key. So after they get diagnosed, what are some of the things that they can a patient could expect?
Yeah, so that depends on specifically kind of how severe their heart disease is and kind of what other comorbidities, health risk factors they have as well. But initially, treatment options would be discussed with the patient, and then counseling about the risk factors like we talked about, to do whatever you can to reduce your risk factors for the progression of the disease.
And how long would that process be, or it just determined by the particular patient or their case?
I think more by the severity. You know, if it's something that's very mild, it might take a little while to actually get in to follow up with the cardiologist and that sort of thing. But obviously, if there's something that's like big warning signs, it would be escalated.
And what's some examples of treatment options?
For like, you know, basic management, you kind of like, they work on reducing your risk factors. Like basically, you know, control of your hypertension, your cholesterol, and weight management, things like that. The other things, or even if you have risk factors, there's other option you can do. You can screen, actually, like, you know, vascular screen and CT coronary calcium score screen is basically kind of like scanning if there's blockage in your vessels, or if there's any calcium deposit in your coronary arteries, your heart vessels, puts you at the risk. So after that, you know, you can follow up with cardiologists to manage all that. And it's ongoing management, so you do not have to face further diminishing of the, further progression of the disease. The other things are like, you know, if you have, based on, you know, how critical it is, you may have to do like a procedure, like, you know, quite invasive, like, which really depends on how you present. Like she said, you know, it depends on the severity.
Can you think of a success story? Just an overview of a success story of someone that came in and they followed the rules, or?
I mean, it really, we see it every day. We don't really, you know, kind of like remember everything, but it's like everyday thing. It's like there's some like amazing, like, oh, that was magic, that was amazing, it was miracle. And, you know, it's kind of hard to pinpoint. Do you have any?
Yeah, and again, you know, you can't really give a specific patient
Right,
details because of privacy.
I said an overview.
Oh yeah, I could tell you so many stories over the years that, I mean, for sure, there's a lot of patients that can have quite severe heart problems, but as long as that's managed well, they can live very high quality lives and very good outcomes. So
That's what I wanted to share. That often people are so afraid that they will not come back, and that it is not the end of the road.
Yeah.
That they do get better with coming in with regular visits, with counseling from you. that there is hope
Yeah.
at the end of the, and not just the end of the road, but sunshine.
Yeah, and
So-
even if a patient has not been compliant with everything, say we gave them advice about diet and stopping smoking and medications, and even if they're not fully compliant, we still want to see you. We still want to
Yeah.
work with you. We still want to try to help you. So instead of feeling bad about going back to the doctor, come in. We'll have a conversation. We'll see what we can do to try and help you.
And I think often when people will say, well, I didn't lose the weight, but I did stop smoking. So we have to celebrate those small,
Yes.
small victories.
Yeah, for sure.
And encouraging people to come back. What are some of the myths and misconceptions?
Well, I think for sure a lot of people think of heart disease as like a death sentence. Like if you have heart disease, that it is what it is. And unfortunately, as we know, it's the leading cause of death in the United States, but so many patients can live very good quality lives with heart disease as long as it's managed appropriately. And certainly the most important thing is early intervention and reducing your risk factors. And so rather than being fearful of it, to try to understand it. We fear the things we don't understand, but the more you
Right.
understand it, the more you sort of become a player in your own healthcare and to try to manage what you can about it. I think also in regards to women in heart health, a lot of times you hear, which is good, but you hear a lot of awareness about women and breast cancer and different types of female cancers. But the reality is 1 in 31 women will die of breast cancer in the United States. 1 in 3 women will die of heart disease. And so a lot of times people think, well, women need to worry about cancer, heart disease is for men, but heart disease affects men and women very predominantly. So
And that's why we wear red.
that's absolutely right.
And I think just getting that big misconception, and we can't reiterate it enough, that people just assume that it's men. And most of the time you hear of a heart attack or whatever, and you say, oh, that happened to a man, but just as many women,
Yeah.
or some, based on some of the statistics. So that means there's 3 of us here. One of us could possibly be for a possible heart attack, or a heart disease.
Yeah.
So we look into that some more. Another misconception you can think of?
I think sometimes patients think like, if I have a family history of heart disease, there's nothing I can do. Everyone in my family dies of heart problems. And that's not entirely true either. I mean, obviously, having a family history is a strong risk factor, but that's not the only risk factor. So you have to look at the things you can control. You can control diet, exercise, medication compliance, stopping smoking, all of those things, controlling your blood pressure, controlling your cholesterol. So there's still a lot of things that can come into play to help manage the disease without just completely throwing in the towel.
Yeah.
And with looking at that, with the risk factors, often I know there's certain things that you can't change. You can't change age, race, your gender, or your family history. But looking at the high blood pressure, the lack of physical activity, I'm sure you've seen some people who were sedentary, and after finding out as part of their progress that they've been moving a lot more.
Yeah, and we actually have a cardiac rehabilitation program at Reid as well for patients who have had heart attacks. So that's something that can get them enrolled in to kind of sort of build up their activity and their health as well.
And how do they find out about that? Is that a referral program? Or?
Yeah.
It is. It's mostly after a procedure done at a hospital after, to get them back to where they are or close to where they are.
And it sounds like often further than they ever were. So and they find out about that rehabilitation during their visits and the counseling when they.
So rehab is designed for people like who already have heart disease, but then
Okay.
they have difficulty doing daily lives thing. They can't walk, or they can't walk too far. They get tired. So kind of like get them back to where they were before, before the procedure or close.
And so it's just another part of the rehabilitation
Absolutely.
of their heart.
Correct.
Correct. Great. What can men and their loved ones do to spread awareness?
Well, they can talk about, be knowledgeable about the risk factors and talk to these risk factors with family, friends, whoever's around. And like I said, do a screening test available, like vascular screening and CT, coronary calcium score, and talk to primary care providers. And, is there anything else you'd suggest? Go red. Wear red. Go to American Heart Association online website,
Yes, they
and
have
they have good
informative.
information.
Yeah, a lot
about
of
all
information.
these. Yeah.
And I know locally we have a lot of different things we do. I know in the community we have an event called Medical Mondays that is sponsored through Reid Community Benefit. And every February, all the participants gather and we wear red and usually talk about heart disease. And we have our annual picture. And every February we do that. So we have a lot of people in the community already aware, and they look forward to that event to celebrate.
That's great.
Learning about heart disease. We are just recently we had Dr. Erica Kretschmann from endocrinology who talked about the association of heart disease and diabetes. So as we try to promote that in the community as more of the community education, that's something that people will be aware of. And also when people go to, we have a fundraiser through the Reid Foundation for wearing, the red dress ball. And those proceeds help with in the cardiology department, which I know you're very familiar. The another idea is as we serve a more rural area, do you see that also with people not going to the doctor, or any differences for like rural health and heart disease?
Well, I think for one thing, in the rural areas, even just access to primary care providers is kind of a huge issue, across the nation. And so I think that's the first step, because if patients can have a good rapport with their primary care provider, and feel like that they can come to them, even if they start having just vague symptoms, that's very often they can catch things early, So I think that's very, very important, is access to health care and to primary care specifically.
So which I'll segue into, Nisha is in our Greenville office.
Right.
So do you often, even more rural even in
more
Wayne
rural.
County?
We do get a lot of patient. That's why I'm assuming that's one of the reasons they do not have primary care help around, or they do, or most of them are. It's limited.
Right.
That's what I meant. So I know some of the patients who have to travel quite a distance just to go to their physicians, and it's kind of disadvantage to them.
So
and
when people often ask why you have an office in Greenville or further out in some of our rural areas, there's a definite need, correct?
Definitely. I mean, and
we were just talking about this earlier, because we actually have a lot of outreach offices with our cardiology group. So they go to Connorsville, Hagerstown, Winchester, Newcastle, then we've got the Greenville office, and there may be some other locations.
There may
I
be
don't know
some
all of
other
them
location
specifically.
that we don't know, or we're not aware of it right now.
Most of the times it's the cardiologists that actually travel.
Yeah.
And that's a definite need to get, because often if they can't get to Richmond, but if it's in their local area, to have that.
Yes.
Yeah, it's at least for the first screening, and if they need to come back and follow up here, or need a procedure that needs to be done, they can, anyone who sees them can send them over there.
As well as vice
refer.
versa, that's great. If they've had their main procedure, then they can
go back and
go
follow
back
up.
to the place that was closer to their location.
Yes. So, in Greenville, we see patient and send them here for a procedure, and they go back and follow up with us after the procedure. So kind of like managing.
And usually with healing, people are very comfortable in their own little area.
Correct.
So that's a definite plus. If I was trying to reach you and then come to your office, how would I find you? So where's your location in Greenville?
Well, there's only one facility, the building that Reid has in Greenville. It's pretty
Okay.
easy to find. We're very close to Wayne Hospital, if you're familiar with Wayne Hospital. And we actually provide service. We provide service in Wayne. We see patients. Dr. Chong and Maria actually sees patient in Wayne Hospital as well. And it's what is it? 1101 Jackson Street is the address for
Okay.
Greenville.
And some of the locations, aside from the main location that you stated, like Connersville. and-
Yeah, there's offices in Connersville, in Hagerstown, Winchester, Newcastle. If anyone had a question about scheduling an appointment with those, they could always call even
yeah.
just the main Reid number, and
And
they
then-
could be able to tell you which specific areas they're in.
Then they would ask for a Reid Cardiology,
Yes.
or
Yep, Reid Cardiology, and I believe we have a slide to show the phone number as well.
and are there any support groups for heart patients? I believe we probably do have some.
Yeah, I know outside of the cardiac rehab, I don't know
Okay.
specifically other groups, but I would imagine we probably do.
Yeah.
Okay, and so they could find that information out by calling the Reid Cardiology, and well, great. Well, I want to thank both of you for joining us in Red today. So thank you, Joy, and thank you, Nisha, for joining us on Reid Beside You. And we'll see you on our next episode of Reid Beside You.